Why do Whipple procedures have complications? Have you ever wondered why the Whipple procedure, also known as pancreatic caudiotonectomy, can lead to complications? This complex surgery is primarily performed for pancreatic cancer and involves removing parts of the pancreas, small intestine, gallbladder, and sometimes part of the stomach. Given the intricate nature of this operation, complications can arise due to several factors. First, let's talk about the anatomy involved. The surgery requires creating multiple surgical connections, or anastomoses, particularly between the pancreas and the small intestine. These connections are delicate and can be prone to leakage. If pancreatic fluid leaks from these sites, it can cause significant tissue damage and lead to serious complications. One of the most common and serious complications is a pancreatic fistula. This occurs when pancreatic fluid leaks from the surgical site, which can lead to infections, abscesses, and even sepsis. Studies show that pancreatic fistulas occur in about 6 to 14% of cases, and they can significantly increase the risk of morbidity and mortality. The mortality rate associated with these fistulas can range from 1.4 to 3.7%, and if complicated by infections, the risk can escalate dramatically. Another significant complication is postoperative hemorrhage, which happens in approximately 5 to 16% of patients. This bleeding can originate from nearby arteries or veins, such as the gastroduodenal artery or portal vein. It can be caused by vessel injury during surgery or erosion due to pancreatic leaks. Hemorrhage can be life-threatening and may require further interventions. Delayed gastric emptying is another issue that some patients face after the Whipple procedure. This condition can cause nausea and vomiting, leading to longer hospital stays. It may require temporary nutritional support, such as feeding tubes or intravenous nutrition, to help manage the situation. Infections and abscess formation are also risks due to the extensive nature of the surgery and potential leakage of pancreatic enzymes. These infections may necessitate antibiotics or additional procedures to drain abscesses. Other complications can include bile leaks, inflammation of the pancreas, blood clots in veins near the pancreas, and narrowing at surgical connection sites. Additionally, some patients may develop diabetes after the procedure due to the loss of pancreatic tissue. It is important to note that individual patient factors also play a role in complication rates. Factors such as jaundice, the extent of cancer spread, and overall health can influence outcomes. Patients treated at high-volume specialty centers with experienced surgical teams often have better results and fewer complications. In summary, the complications associated with the Whipple procedure stem from the complexity of the surgery, the delicate nature of the pancreas, and the need for precise reconstructions. Pancreatic fistulas and hemorrhage are among the most serious complications, while delayed gastric emptying and infections are also common. Careful surgical technique and thorough postoperative management are essential to minimize these risks. Always consult with healthcare professionals for personalized advice and information regarding this procedure.